Dear readers and endoscopic peers in Jia-Qi, I am Dr. Jia-Qi Xu from Zhongshan Hospital, Fudan University, Shanghai, China. Thanks for the invitation to participate in this novel project. It is a great honor to give the author interview on behalf of the corresponding authors, Dr. Pingheng Zhou and Dr. Quanling Li. Our original article, entitled "Repeated Endoscopic Submucosal Dissection: A Salvage Treatment for Local Recurrence of Esophageal Squamous Cell Carcinoma After Initial ESD," is about to be published on this month's GIE journal. This study aimed to determine the efficacy and safety of repeated ESD for recurrent ESCC. It was a retrospective study carried out in one of the largest tertiary hospitals in China, Zhongshan Hospital. Endoscopic submucosal dissection is now a standard treatment for early superficial ESCC with minimal risk of lymph node invasion like epithelium lamina propria in depth. Muscularis mucosa or submucosal carcinomas, which had a risk for lymph node metastasis, were relative indications for ESD, with prophylactic chemoradiotherapy performed subsequently. Despite the favorable long-term outcomes of ESD for superficial ESCC, substantial recurrence did occur, ranging from 0.9% to 9.1%, which would compromise survival of patients. However, the standard treatment has not been established. We wondered whether a repeated ESD for local recurrent ESCC would be an optimal choice, with minimal invasion and decent outcomes. In this study, 43 consecutive patients with 45 locally recurrent superficial ESCC undergoing repeated ESD were compared to 45 lesions undergoing first ESD after propensity score matching at Zhongshan Hospital between 2011 January to 2020 January. As compared to first ESD, the complete resection rate and curative resection rate were lower for the repeated ESD. The procedure duration and hospital stays were longer for the repeated ESD as well. One might attribute it to the technical difficulty during repeated ESD, that severe and extensive fibrosis and the narrowed lumen had added to. The en bloc resection rate and incidence of adverse events, including bleeding, perforation, and stricture, presented with no difference between the two groups. Despite the lower resection completion, the 5-year overall survival rate and recurrence-free survival rate for repeated ESD were inspiring, which were 100% and 86%. And those recurrent lesions were further managed by a second repeated ESD. We also revealed that multiplicity was significantly associated with recurrence after repeated ESD. Thus, we recommend intensive follow-up for patients with multiple ESCC regardless of curative resection. Based on these findings, we came to a conclusion that repeated esophageal ESD with favorable short-term and long-term outcomes would provide an alternative choice for recurrent superficial ESCC. As the incidence of local recurrent ESCC was low, we might be able to expect further large sample study based on multicenter work. Besides, as salvage surgery for local recurrent ESCC was theoretically practical. Comparison between repeated ESD and salvage esophagectomy would help identify the first-line treatment for local recurrent ESCC. Thanks for watching the video. We sincerely hope the study would benefit you when treating local recurrent ESCC. Thanks again.